The answer for one patient may not be the same as the answer for another patient.
Yeah.
And so what we love to do at our clinic is test each individual, take a really thorough case history, make sure we understand their situation, their ear, and then of course test it. We need to look at it, we need to examine it, we need to test the eardrum, test the ossicles behind the eardrum, test acoustic reflexes, test the hair cells of the inner ear, do a comprehensive audiologic evaluation, and test their word recognition ability.